Good morning, everyone. Thank you for joining us for our monthly meeting of the Inland Coalition on Aging. My name is Dr. Ben Howdigi. I am honored to serve as your board chair. We have a fantastic meeting today. I'm excited. We have a phenomenal speaker who's going to talk to us about LTSS, long-term services and supports. But before we get there, want to go over the agenda really quick so you know what we're talking about today. We're going to do a recap of our phenomenal IEMPA conference we had last month. Hopefully you joined us and enjoyed the conference. We had a tremendous list of speakers and we learned a lot and really had a good chance to network and chat and talk about next steps. So it was a very rewarding experience. So thank you for those that joined us. And if you didn't join us, that's okay. We're going to recap and catch you up so you can join us in these discussions. After that, we're going to talk about some key points of the last meeting. We had a great presentation on housing. After that, we're going to provide you some more updates on MPA. I don't know if everybody's noticed the trend here. We are focused on the master plan for aging. This should excite you. This should be something that you appreciate as we, the Inland Coalition on Aging, have purposely, intentionally been focused on one thing. Until we launch this master plan, that is our focus, our intention, and we are not wavering. So hopefully you see that and appreciate that we're not wavering because we want to make sure that's in place. Once that's in place, we can definitely expand our reach and our support for all of you and all that you're doing to improve aging well in the Inland Empire. After that, we have a housing panel, and then we'll talk about next meeting. All right, next slide, please. That is me. Hello, everyone. So the conference, we just had our second annual Inland Empire Master Plan for Aging, our roadmap to aging well in the Inland Empire. We had some phenomenal guest speakers. Are there some pictures there? Can we go to the next slide? Yes, wonderful pictures. We had close to 250 folks attend this conference on Friday, uh, Friday, September 27th. We had about 250 people show up, including leaders from various staff from various organizations, aging organizations, organizations that serve older adults, adults with disabilities, and caregiver organizations. On the left, you'll see an image, a picture of the group. You see that it was well packed and beautiful flowers there. Thank you to all the folks who worked on decorations and setting up the venue. To the right of that is myself and the Honorable Cheryl Brown. She's the chair of the California Commission on Aging, and next to her is the executive director of the California Commission on Aging. Next to her is Cheryl and the assistant director of the Department of Aging and Adult Services, Glenda Jackson. Next to her was Sandy Wyman, who works here at IEHP, and I can't tell you how many great feedback we got from her presentation. It was very touching and folks enjoyed that. So thank you for staying to the end for that presentation. Next to her is Supervisor Spiegel, Karen Spiegel. We've had very fortunate to have the support of the Board of Supervisors for both counties. You'll see Supervisor Spiegel there on the right-hand side, top right-hand corner, and on the bottom left-hand corner, you'll see Board of Supervisor Joe Baca Jr. from San Bernardino County. So glad they could make it out. Next to that, Supervisor Spiegel, myself, and our IEHB Director of Government Affairs. Next to that is the phenomenal team of and employees of Inland Caregiver Resource Center. I got to tell you, they were the backbone of this conference, and they provided so much support. They checked people in. They made sure folks had a place to sit, and the refreshments were served and everything. So thank you once again to Carmen Estrada and her team, who were phenomenal volunteers on the day of. Next to that, you'll see the board of the coalition, myself, Jennifer was representing the Office on Aging there, and then Anna represents Community Access Center, and Glenda represents the Department of Aging. Last to the right was our Chief of Health Equity at IEHP, She presented on a panel, and that panel was phenomenal. The top-notch speakers on that panel, and it was just well received. We received a lot of great input about that panel. Next slide. So if you missed it, you don't want to miss the next one. We had good food, good company, good conversations, good learning, good networking. And the next one, next time we meet, we will have a master plan for aging. So definitely don't want to miss that. The last ICA meeting recap, we always want to do a recap because we know some folks can or cannot make it. And there's some important points to take away from each and every conversation that we had. We had Kristen Mathionis. She's the Director of Housing Services for the County of San Bernardino Housing Authority. It was fantastic. We talked a little bit about, I'm sorry, the key points are not matching the presenter. I believe this might be a typo. Somebody correct me if I'm wrong. But Christine, no worries, Christine. I'll tell you what we did. Maybe stop sharing the screen there while we fix this. But Christine talked about the Housing Authority, what they do, what they provide. It was very helpful to review that information and make sure that everybody here. So important that we all know and understand what our community partners do, what they provide, who they serve, who's eligible for services, because that's only going to help us to strengthen our ability to serve the constituents, the clients, the customers that we serve. So very well received information. So I appreciate the Housing Authority joining us for that presentation. I think that was it as far as recap. Carmen, do you want to move on and
Sure.
what?
So we do have a few updates from the Inland Empire Master Plan for Aging. As if you attended the conference, we did go over our framework, right? Where we shared the goals and the activities that we have created after meeting for several months. The work groups met from February to August to create goals and objectives and activities for each of our goal areas. And so at the conference, we unveiled our framework. We shared what we came up with. We also shared a document that we would like your feedback on. And so as we continue to develop our first full draft of the master plan for aging in the Inland Empire, we want more feedback from all of you, professionals, stakeholders, the community, on each of the goals that we've created. Are they appropriate? Do you have other ideas or suggestions? Can you identify leaders or organizations that we should be collaborating with so that we're able to implement the different activities that we have put together? And so we shared that document at the conference. We're hoping to get feedback from all of you so that we can create a final draft. Once we create the draft, our goal is then to go out into the community to get more feedback. And so we keep asking you all for feedback, right? We asked you for feedback at the work groups. We asked you for feedback at the conference. We're going to continue to ask you for feedback. That's the process. That's the process that we need to follow to create a full Inland Empire Master Plan for Aging so that we can make sure that we don't miss anything. And so once we create our draft that we are scheduled to finalize at the end of December, we're going to be going out into the community, share the draft with the community, get more feedback so that we can have a final draft by June 2025. So that's when we plan to unveil our Inland Empire Master Plan for Aging. Still a lot of time for you to provide that feedback. Again, I want to stress and emphasize because we're gonna all work together to implement the different ideas that we have, right, for our master plan. And so it's really crucial that if we're missing a partner that we should be collaborating with, we don't have all the answers. When we were creating this plan, there are going to be gaps that we're missing. And so that's why we look to all of you to give us, feedback and suggestions. And so this is our plan. And we're going to keep sharing it at each of our monthly meetings here at the ICA, because like Ben said, this is our focus. And, even after it's created, there is going to be implementation, right? We're not creating this plan so that it could just sit there. We're creating this plan so it could be an active plan that we can modify and change as needed but that we also implement as a community. So those are updates there for the process. Other updates that we have, can you go to the previous slide, Jaritza? I think I went backwards. So the previous one, there you go. We were able to submit finally our AARP application to be an age-friendly network. That required us to receive letters of support from both boards of supervisors from both counties. So we have been able to get the support now of both boards of supervisors. We have submitted the application, and soon we hope to be able to say that the Inland Empire is age-friendly. So that's in the process. Other updates on outreach events that we held or that we've participated in. Right after the conference that we had here in the Inland Empire, we went up to Sacramento and we participated in a California Collaborative for Long-Term Services dinner where we shared our progress as the coalition here representing the Inland Empire. And we were able to participate on a panel where we shared our progress for other communities that are also engaging in creating local plans. So that was really an honor to be able to participate in that panel. The day after that, we participated in the California for All Ages and Abilities Day of Action, where the California Department of Aging shared the progress that the California Master Plan on Aging has conducted. And then on the 21st, yesterday, we actually provided a presentation for the California Commission on Aging on our local master plan. So a lot of outreach that we've been conducting. And if you're interested in helping us continue to spread the word, you go onto our website and you can have access to all of our social media toolkit, information, brochures that you can share out in the community.
Carmen, if I may just add, Carmen did a phenomenal presentation yesterday at the California Commission on Aging. All the commissioners were there, some local representatives were there, and she talked about our work for the past 2 years on the development of the Master Plan for Aging. And these commissioners represent are coming from throughout the state, and several of them were just so impressed what we've done here in the Inland Empire. They've asked for our help, actually. Several reached out and said, "Can you help us in our county? We need help. We're not there yet. We haven't started working on this, or we can't even bring the community together. How do we do this?" And it was very refreshing to see that they appreciate all that we've done, that we've been featured in several publications on what we've done here locally, and this is all you. This is all you. Just like Carmen said, when we're coming to you and asking for your feedback, this is all you're doing. All this coalition's work has really garnered some just good comments and feedback from many organizations. So just know that statewide, we are making an impact here in the Inland Empire, putting Inland Empire on the map, so to speak. So thank you, Carmen, once again for a great presentation.
Yes, of course. All right, so we'll go ahead and turn it over to our keynote or keynote. I'm still in conference mode. Keynote speaker. Our speaker for today. It's an honor to have Mariya Kalina, who's the executive director of the California Collaborative for Long-Term Services and Supports. And this, I want to point out that how we do hear your feedback was a request from several of you. We wanted to learn more about long-term services and supports and what that entails, advocacy. So we invited an expert who I feel is an expert, Mariya Kalina, to present on long-term services and supports. I'll go ahead and turn it over to her. Thanks, Mariya,
So much, Carmen, and I hope everybody will bear with me because I do have a presentation I want to screen share. I've just got to get it up.
Mariya, while you're doing that, if I may just share, in case folks are not aware of our mission statement, the Inland Coalition on Aging, our mission statement reads, "The coalition is committed to facilitating systems change across networks and developing improved integrated care and service delivery of long-term services and supports." Yay!
Woo-hoo!
So this is core to our mission, understanding long-term service and support. So take this information and apply it, and this is part of our mission. So very important message learning we're going to have here today with Mariya. Thank you, Mariya, for joining us.
Thanks, Ben. And we'll talk about it a little bit more today, but I think LTSS is such an umbrella term, and really this could probably be like a multi-series type session. So this is a high-level overview, and hopefully it's helpful to you all. Thanks so much for inviting me today. My name is Mariya Kalina, as Ben and Carmen said. I'm the Executive Director of the California Collaborative for Long-Term Services and Supports. It's a mouthful. We just say California Collaborative for short. I've served in this capacity for nearly 3 years, although my history with the organization as a consultant does go back to its inception in 2011. And I've spent about 20 years working in the public policy space on everything from child development and preschool issues to Affordable Care Act implementation, to farm workers' health and well-being, and so forth. But most of my time has been in the aging and disability space, which is something I'm really proud of. And so it's incredibly exciting to be here today to share a little bit of aging and disability data, talk about efforts underway to reshape the system of care. And lastly, maybe hopefully inspire some of you to engage and continue to move that needle on some of the pressing issues facing California's older and disabled adults. Well, I should have flipped to that slide a little while ago. So what is the collaborative? We are a statewide coalition comprised of state-level organizations, AARP California, Alzheimer's Association, United Domestic Workers, California Commission on Aging, Justice and Aging. The list goes on. That's just to name a few. So we have our state-level organizations as well as 19 regional coalitions that span 46 of California's 58 counties, and that includes the Inland Coalition on Aging. ICA has been a member of the network and a key partner for many years. We've been really privileged to work with Ben and Carmen and Elizabeth and the team there, and so it's been a great partnership. The California Collaborative works sort of in 4 primary areas. One is we work to foster understanding among our membership about all the different components of long-term services and supports. And not just the components. I think there's always a lot happening at the state. Sometimes it's good, sometimes it's bad, sometimes there's a new pilot program. And so we do hold public webinars every so often to just provide a quick update or to share new research. We also work to educate policymakers about the needs of older adults and people with disabilities. We do an annual advocacy day at the Capitol where we bring our membership in for meetings with elected officials. We do go to budget hearings and testify on behalf of older adults and people with disabilities. We have a couple of different publications that we've put together for the legislature as sort of training tools. We do have, legislators who term out, new legislators come in, and so we're kind of always in this phase of learning and teaching and making sure that older adults and people with disabilities are seen and visible within the legislature and the administration. We also have a tremendous amount of expertise within the collaborative. Folks like Carmen and Ben and lots of others who just really, really know their stuff. And so we like to bring people together to just be able to talk about some of the challenges, to explore solutions, and put together recommendations for improvement that we end up sharing out with the administration and legislature and advocating for. Lastly, I think the power in the collaborative is really about building connection. You as the ICA, you are not alone. There is a whole group of like-minded individuals across the state that are working towards the same objectives. And so pulling people together, pulling in the expertise, building those relationships and supporting each other on behalf of, older adults, people with disabilities, and our advocacy is really the role of the collaborative within California. Okay, so I just wanted to start this off by grounding ourselves in what we know about California's older and disabled adults. First, we know that California's population is growing older. And while there is a gradual decline in all other age categories from birth to age 59, we're seeing a consistent growth in our older adult population. In 2020, adults 60 years of age and older made up about 20% of California's population. And we're on track to see that jump to 25% or 1 in 4 Californians by 2030. And if we look even further out to 2060, when millennials like myself phase into older adulthood, the share of seniors in California will be just over 33%. And I don't think that these statistics are, you're probably not seeing these for the first time given your work around the master plan, but I think it is a helpful reminder and it helps us to stay grounded in why this work is so important because it impacts so many people. I do want to say that the growth is not happening equally across the state, right? We're not all experiencing the same amount of growth. Older adult populations in far north counties will decline over time, while other counties will experience double-digit growth. So, for example, we've got Mariposa County located in Central California, shaded here in the darker orange color. Mariposa will see a 46% decline in older adults, while San Benito on the Central Coast in the dark blue shading will experience a growth of upwards of 157%. Riverside and San Bernardino will experience a significant incline. So you guys are on that side of it, nearing that double-digit growth, with Riverside projected to see an uptick of about 84% and San Bernardino about 91%. One of the key intersections that the collaborative works to elevate, recognize, plan for, and address across policy solutions and ecosystems is the intersectionality of aging and disability. So you can have a disability at any age, right? It's not necessarily entirely correlated to how old you are, but the likelihood of someone age 65 and older developing a disability is 26%, compared to 19% across all other age groups. And that likelihood declines as you move down in age category, as you see here. So overall, California is in the midst of 160% increase statewide in the number of older disabled adults who check both boxes. The other significant demographic data point that relates to California's diversity, it relates to California's diversity. So California is already one of the most diverse states in the nation, and it will continue to diversify in the coming years. So by 2030, California's older adults will predominantly be people of color, and we will continue to diversify as people of color grow to make up 73% of the overall population by 2040. And this has some significant impacts. So as we talk about systems change, how do we ensure that our systems are culturally appropriate, right? Californians are also living longer than ever, with life expectancy on a steady climb since the 1950s. So based on a longevity study from Stanford University, Gen Alpha, the 5-year-olds of today, will live on average to 100 years old. But there are significant inequities in health outcomes across race and ethnicity. So, for example, as a result of the COVID pandemic, California saw a significant drop in life expectancy rates, but that decline was not consistent across the board. So for Hispanics, life expectancy declined by nearly 6 years, while in comparison, white Californians saw a decline of just 2 years. And what that tells us is that there are inequities in the system. So let's switch gears a little bit. So when we hear the term long-term services and supports, or LTSS, what exactly does that mean? What are we talking about? While LTSS is an umbrella term that describes a wide range of medical, social, and personal services and supports that are needed over an extended period of time by individuals with functional limitations. So just for example, our family's matriarch is in her 90s, and she's a fairly healthy and feisty woman. She loves her family, especially her grandchildren, enjoys a good romance novel, reminiscing about the olden days. But she's not able to get around as well as she used to. She no longer drives. Her hearing has declined in recent years, and she's experiencing some cognitive decline as well. So with that, she needs a little bit more help than she used to, helping getting her medications in order, a ride to the doctor's office, to her hair appointment, some support with personal care like bathing, maybe some modifications around the home like the install of grab bars in the shower. And all of these things fall under that umbrella of long-term services and supports. And I always say if she's able to get the care she needs, she may just outlive us all. um, so examples and settings. LTSS can be provided in a variety of settings, right? It could be in the home, it could be in the community, it could be in facilities where individuals have access to more intensive medical care. Home and community-based services, or HCBS, which is another term that you may have heard, specifically describes supports that an individual might receive in their home or in the community setting. So before Papa passed away, Grammy and Papa lived together in Sonora. They had a decent amount of property atop a hill overlooking the countryside. Towards the end of his life, Papa needed around-the-clock care. So when Grammy would travel to visit friends, family for the holidays, she would have somebody, a home health aide, come to watch over Papa. So that's an example of home-based care. And after Papa passed, Grandma sold her home and she moved in with family. So now she's well cared for by a family caregiver. And that's another example of home-based care. And a few times a week, Grammy visits with her friends at the local adult day health center, providing much needed social interaction for her and a change of scenery and a bit of respite for her caregiver. And that's an example of community-based care. Now, Grammy didn't have the family support she has now, she probably wouldn't be able to live independently. And she might have to move into something like an assisted living facility where she can still come and go as she pleases, but there would be support in place to ensure that her needs are met. So they offer things like medication management and meal prep and personal care assistance. And then worst comes to worst, and maybe her health declines and she requires more intensive medical care. Grammy might have to transition into a nursing home. And nursing homes fall under the category of facility-based care. And while facility-based care is not part of the HCBS continuum, it is part of the LTSS umbrella. So that's the difference. When you hear HCBS, think home community. LTSS is that broader term that encompasses home, community, and facility care. Most older adults do prefer to live in their homes and communities, so policy discussions have really shifted in recent years to focus on HCBS and building that system out. And I think the goal is really to ensure that people can live in their setting of choice with the supports that they need to be able to thrive in that setting, right? But one of the big challenges in accessing long-term services and supports is that it's an incredibly complex and extensive web of services, and they're siloed across multiple government agencies. They're not consistently available across the state. And for individuals who are not able to access the care they need, health is likely to decline. And that's true for someone who's 25 years old and isn't able to go to the doctor for their checkups, as it is for somebody who's 85 years old, right? If you're not able to get care, it's probably going to get worse. The issue will get worse. For older adults, in addition to poor health outcomes, lack of access to supports also increases their chances of needing institutional care. And we'll talk about this too, but institutional care is far more expensive than home and community-based services. So it does drive up state expenditures when we do not take care of ourselves, right? I know this is an overwhelming slide, but speaking of a complex system, this slide, while a bit dated, helps to visualize that complexity. Each of these boxes reflect the various LTSS programs in California. We have community-based adult services, On the right in yellow, we have PACE in blue, HSS in red, regional centers in dark red, and so forth and so forth. And each different shading describes which state department oversees that particular program. So this is a system that's hard to navigate at the policy level because you have to know which tree to go bark up. But let alone as an older adult trying to get the care they need in the community. Meanwhile, the need for care is steadily growing. Not only are there just more older adults than ever before, but we're seeing more older adults that are living alone. And a study conducted by UCLA found that more than half of California's older and disabled adults reported needing help with routine care. And who is providing that care? The vast majority rely on unpaid care from family and friends. California is home to 4.7 million family caregivers, and they're predominantly women, particularly women of color, and they often juggle the responsibilities of caregiving alongside work and raising children. They spend, on average, between $7,000 and $13,000 in out-of-pocket expenses related to caregiving. And in return, they provide California with $63 billion in economic value and a cumulative 4 billion hours in unpaid care. In addition to informal family and friend caregivers, we also have professional caregivers that work across all three LTSS settings: home, community, facility. These are individuals who receive pay in exchange for providing care. And again, they are predominantly women. They are predominantly people of color. 47% are immigrants. They are not well compensated for what they do. And what they do is often very emotionally and physically demanding. Nor do they have access to the range of benefits that other professions offer, like retirement contributions. So 47% of this workforce has to rely on public benefits to get by. And I think that's a really sad statistic, right? But also because of this, California is facing a major shortage of professional caregivers. So job openings for direct care workers exceed that of occupations within similar pay ranges. And we're really, really struggling to fill those positions because, well, we don't have a lot to offer in exchange, right? Simply put, we just have a supply and demand problem. The number of older adults who need care is increasing, as are preferences for aging in place, but there are less family caregivers available to support, which means a greater need for professional caregivers. At the same time, we know this work is not easy, and we're failing our caregiving workforce by means of low wages, certainly below the cost of living, and limited resources to get it dedicated to training and support that not only promotes health and well-being of care recipients, but also equips professional caregivers with the tools they need to thrive in their jobs. And LTSS can be very expensive. It's out of reach for many Californians, that's for sure. So even if they sold their homes, half of our middle income older adults wouldn't be able to afford private assisted living. These are figures from 2019, and the costs have gone up since then. The average cost in 2019 of 5 days of adult day healthcare per week was just over $20,000. 30 hours a week of home health aid cost about $43,000. Assisted living, $54,000, and nursing home care was easily $127,000 per year. Cost does vary by California region. So in some places it's a little more, San Francisco, some places it's a little less. But since 2019, again, costs have only gone up. And for those on fixed incomes, LTSS is increasingly becoming more unaffordable. For that reason, the majority of LTSS costs are paid for by public sources. In 2020, the United States incurred $400 billion in LTSS costs. This is not California specific, it is the US, so something to keep in mind. But 70% of that was funded publicly. Medicaid is the primary payer. They cover roughly 42% of all LTSS costs across the US. Medicare, on the other hand, only covers about 18% of total LTSS expenditure. And despite the popular public misconception that Medicare will cover all the costs, in California, Medicaid, more commonly known as Medi-Cal, is not available to Californians below the 138% of the federal poverty level. That translates to just over $20,000 in annual income for individual. So that bar is pretty low. According to NORC, by 2033, 1 million Californians will be at risk of spending down, meaning they'll fall into poverty and eventually will need to rely on Medi-Cal to cover LTSS. Individuals with incomes between 401 and 650% of the federal poverty level are not likely to qualify for Medi-Cal. And 89% of those individuals who fall in that category wouldn't be able to afford LTSS without selling their homes. So there's a real affordability issue here, right? I want to talk a little bit about poverty among older adults because a staggering number of disabled and older adults in California live in poverty. While the average poverty rate in California hovers just above 11%, the poverty rate among older adults is just above 16. Individuals with disabilities fare even worse, as a poverty rate of just over 26%. And with the high cost of housing, older adults are really at the center stage in this homelessness crisis. According to the Budget Policy Center, during the course of 2022-23 fiscal year, local California homeless service providers made contact with over 215 adults needing to find a home. Of those, nearly 40% were adults 50 and older. And in a number of counties, San Francisco is one example, older adults already make up nearly half of the homeless population, many of them encountering homelessness for the first time of their lives. California's older adults are also rent burdened. So California defines affordable housing as housing that costs no more than 30% of a household's gross income. And that is not just, mortgage or rental payment, but that should include utilities, insurance, all of that good stuff that you need to have if you're going to be living independently. So for older adults renting a home, currently 35% are spending more than half of their monthly income on rent alone. And that leaves them with very little money for other expenses like food and personal items and even medical care. So I know that this is a lot to take in, and thus far, I think we've mostly focused on all the big challenges that are facing this population. But there is some incredible systems change work underway. And I won't spend too much time talking about it, but I feel like, we talk about the master plan all the time. The master plan for aging was released in 2021. It was informed by a year-long stakeholder engagement process and thousands of public comments and recommendations. And it outlines 5 bold goals, 23 strategies, and over 200 specific initiatives from housing to healthcare, caregiving, transportation, and beyond. All of that aimed at preparing California for this demographic shift. And we're sort of building the plane as we go. But the MPA has really been this catalyst to bring greater awareness of older adult and disability issues across legislative, administrative, and intersectional policy sectors. Here in Sacramento, we're engaging with transportation agencies, something that we haven't done traditionally, So it really has kind of created this fantastic partnership. And we're in a time of fantastic momentum and energy, and it's driving real change. And aside from the ongoing work at the state level, communities like Inland Empire across California are adopting the local playbook. and developing their own strategies to advance age and disability friendly policies. Currently, there are, maybe I have a slide for that. I do. Currently, there are 39 counties of California's 58 counties that are actively engaged on this front. Inland Empire is not alone. You guys are definitely maybe ahead of the curve in terms of where other counties are, but this really has been something that has just taken off at the local level. And you can see just by the chart there, a couple counties, we're not sure what they're doing. Many are in the phrase of raising awareness and trying to build that coalition, trying to get that going. Some of them are in the phase of planning. I know Inland Empire is in the phase of development, very close to having that document ready. And then there was also a statewide grant opportunity called LADAP that a number of regions applied for and received. They've had 2 rounds thus far. So there's some state funding available to support those planning efforts. And then at the intersection of healthcare, I just want to highlight that California is a few years into a monumental overhaul of its Medicaid or Medi-Cal system, with this goal of improving health outcomes by addressing disparities and social determinants of health. It's called California Advancing and Innovating Medi-Cal Initiative. We just call it CalAIM because that's way too long. But it boldly leans into this notion that well-being is not solely connected to being in a doctor's office, that it's housing, it's nutrition, it's transportation, and social connectedness. And it's all of these things really coming together that determine the quality of life and ultimately an individual's health status. So through the CalAIM initiative, the state is building a greater connection between health and social services via enhanced care management and community supports, and also working to expand the availability of services so that whether you're in Sacramento or Humboldt or the Inland Empire, you can access the care you need. The CalAIM initiative hasn't rolled out without a few bumps on the road, I will admit. But I think big, bold policy change is always a little bit bumpy at the start. We learn, we adapt, we change, we make it work. And I think overall that this vision of connecting health and social services is coming to life in CalAIM. So we're really excited to continue to see improvements in that and then continue to see that progress. So there's still a lot of work to do to achieve the vision of the master plan for aging at the state level. California has had some really significant wins in the past few years, and there's really, I was prepping for this presentation and doing some snooping online and trying to refresh my memory. What the heck have we been working on for the past couple of years? And that was a lot. So I'm going to try to just summarize some of the highlights. The Master Plan for Aging annual report is available online. It will go into some more detail there. We've also had some wins from this legislative cycle that I can summarize quickly. And I apologize in advance. This is probably just going to sound like a long laundry list, but it's a lot to cover in a short amount of time. So in the 2022-2023 fiscal year, the administration and legislature invested more than $20 billion into affordable housing, which directly impacts sort of a wide range of populations across California, but also older adults and people with disabilities. We've worked to restore nearly $500 million in prior cuts to the IHSS program and to increase the number of Medi-Cal assisted living waiver slots. Really proud to have an HCBS, home and community-based services gap analysis and roadmap underway. And this really just a survey, a survey to better understand gaps in services across the state and then kind of develop some strategies for increasing access to ensure that no matter where you live, that you can age at home and in your community. The Medi-Cal program now covers individuals over the age of 50, regardless of immigration status. That's a $1 billion ongoing investment to expand access to full scope Medi-Cal benefits. The state has moved forward with the elimination of the Medi-Cal asset test that ensures older adults can avoid impoverishment, may qualify for Medi-Cal. And I just want to say, recognizing that many struggle to finance their LTSS needs, the state invested $5 million to support data and research of financing options, building off of the work that has already taken place in the long-term care insurance task force. So there has been a lot of sort of behind the scenes back work to try to figure out how do we really address this affordability crisis, and that snooping around and trying to find strategies is ongoing. So we're really excited that the momentum there hasn't been lost. We've stood up a new office within the Department of Healthcare Services that solely focuses on developing and implementing program improvements for California's 6.5 million Medicare beneficiaries. There's been a number of investments in Alzheimer's and dementia awareness and care via the California Healthy Brain Initiative and the Dementia Care Aware program. In response to the growing need for APS services, California expanded eligibility for APS to a wider number of people by lowering that eligibility age to 60 from 65. On the caregiving front, in 2022, Governor Newsom signed landmark legislation that supported family and friend caregiving. The bills were, I think, SB 951, which increased family and disability leave to support low-wage workers. We also had AB 1041, which enabled workers to take paid sick leave for family leave in order to care for any person designated by an employee, including non-family members. There's been investments in workforce training with the IHSS Career Pathways Program and CalGrows, which really which provide paid training. So that was sort of a benefit of that. CalFresh was expanded to Californians age 55 and older, regardless of immigration status. And there's been some significant investments in home delivered and congregate meals, as well as capacity and infrastructure improvement grants for senior nutrition programs. I would say, 2022, 2023, California's budget ebbs and flows, and we've sort of had benefited from an economic boom over the past few years, much of which can be attributed to an infusion of federal funds during the COVID emergency. 2024 was a little more challenging. This year, the state faced a significant budget shortfall. And so what we did at the collaborative, what advocates did across the state, was really rally and focus on trying to preserve the gains of the past few years. And we were successful in being able to keep IHSS for undocumented Californians, ensure that the IHSS backup provider system was up. Home Safe has been continued through advocacy efforts. The legislature rejected the proposed cuts to APS expansion and training, as well as the proposed $111.6 million reduction for Older Californians Act funding, which would have significantly impacted access to nutrition services. So it's hard to say what the budget for 2025 to 26 looks like. The collaborative is gearing up for another year, full swing efforts, and we'll be engaging with ICA and our other members across the state to build out sort of our shared collective policy priorities and advocacy strategies, prioritizing access to LTSS, which again, it's such an intersectional issue. It's housing, it's transportation, it's all the things that you might need to be able to, successfully thrive in your home and your community. And caregiving for both family and friends, as well as our direct care workforce. So I know I'm running kind of low on time. I think we wanted to have Q&A, but I will kind of wrap up by saying bringing the vision of the master plan to life is a heavy lift. It's a bold, heavy, monumental thing. And the more we can come together and coalesce priorities and be able to communicate them out succinctly, the more we can achieve. So we heard loud and clear a few weeks ago during the Master Plan for Aging Day of Action that Ben referenced at the very beginning of this meeting, that that the legislature is here to help. There's partnership at the administration, the legislature's wanting to roll up their sleeves and do something, but it's very hard to respond when there's 30,000 different asks on the table. Because while aging and disability are critical issues in the state, we also have climate change and children and education and all of the things. And so where we can come together and say, look, this is what we want. These are our top 3 priorities. We just become stronger being able to do that. So these kinds of conversations where you're getting together and you're able to prioritize a laundry list of things that have been neglected for a long time, things that need to change, that is where the strength is at. So I'll leave you just by saying, keep engaging in bodies like these, extend your expertise to local elected officials, city leaders, boards of supervisors. You can just call them up and schedule a meeting. Legislative in-district staff would love to meet with you. And look for local champions too. If there's somebody who's just really killing it out there, see if they're interested in an elected official position. I do want to say, the master plan for aging was born out of an executive order coming from Governor Newsom. And the way that happened was we had a We Stand With Seniors campaign. Ben, Carmen, you guys might remember that. And older adults, people with disabilities showed up at campaign events to ask the governor, what is he going to do for older adults and people with disabilities? And through that process, we were able to get that commitment from him that he was going to do something. So when he got into the office, the master plan for aging sort of came naturally as a next step. So continue to engage, continue to push, continue to talk about these issues. And I will just stop there and maybe look to Ben or Carmen.
Yes, hi, Mariya. Yes, a lot of great information and a lot of great discussion on the chat too. People responding to some of the information that you presented. But I like what you said about coming together. And this is something that if you attended the conference that we had a few weeks ago, Andy Amparato made the same comment that if individuals, adults with disability community and seniors, if we joined forces, imagine what could be possible. Each has already done a lot on their own, but really coming together, we're a force to be reckoned with, right? And that's what it's about. And so I appreciate, the governor staying true to what he said he was going to do something, but now it's up to us, right, to do
It
our
is
here locally. And it is sometimes very overwhelming because there's so much that needs to get done, but we need to start somewhere, and we need to prioritize. And that's why I always say, we need your feedback. We need your feedback because we're not experts. I myself have been learning so much along the way these past 2 years that we've been working on this. But I don't know everything, Ben as well has a wealth of knowledge, but we don't know everything. We don't know all of the different resources. And so it's important that we continue to come together, platforms like this to share, to talk. And even though it sometimes may feel like we're saying the same things, but sometimes that's what we need to do. Keep saying the same things, and then eventually we can put together a plan and start implementing some solutions. So again, thank you, Mariya, for coming and for presenting a lot of information. We'll probably be inviting you again to do maybe even a second presentation because it's a lot to cover. And it's
It is a lot to
research.
cover, and I think we can just kind of hone in next time and get a little bit, more detailed, Carmen. So anytime, and I know that there was a lot of data that might be useful to you all, so I'll be sure to share that PowerPoint with Carmen, make sure that gets into your hands. Also, the link to the MPA progress report I think might be helpful to check out. And anytime you have questions, just feel free to reach out. Love working across different sectors, across different partnerships. And I just want to elevate one other thing. I've been working in this field since 2011. I am not an expert on aging and disability. And it's like Carmen said, we might be really good at understanding one piece of it, but how they all fit together takes all of us in the same room being able to talk that through. So And even lived experience, I think, is such an excellent element of this. So if you have a story, share it, because when data comes together with the stories and the human element, that's where the magic happens in making a case for something. So thanks. And shout out to Anna. I saw you on earlier. Thanks.
And did you have anything else to add?
I just wanted to say thank you, Maria. I love the presentation and especially the slide that showed the periodic table of long-term service and supports providers. I hope everybody got a glimpse of that. It really shows the diversity of us, the Inland Empire Coalition on Aging. All of us are part of this. It's not just healthcare, it's not just social services, it's not just caregiver services. All of us have a part in this, and I hope that you saw that, and we need to share that slide. I loved it. And Maria, if I could steal that from you, borrow, whatever, let me know
I
what
will
the
make
source
sure
is.
you have it,
I
Ben.
love that slide.
I will make sure you have
But
it. It's old, but it
it
still rings true.
reinforces what Carmen said and what everybody said at the conference, that we all working together can definitely do make some big impact. And speaking of big impact, I actually have some huge news to share with this group. You're hearing it first, well, second maybe. The board knows about this, but if everybody could get ready to do a virtual clap, I think this is going to be worth it. If you want to practice, everybody, really quick, how do you clap? Down below, react, and you clap like this. All right, get ready for this. As you know, we've been working on um, the MPA, the Master Plan for Aging, for 2 years, have done a lot of stakeholder feedback, input from multiple organizations, communities. We've been out to the desert. Elizabeth has been out to the desert gathering stakeholder input. We've read reports from multiple organizations. We put all this information together. We worked with you and we've sought your input. We've focused on and been intentional on ensuring that we capture the voice of adults with disabilities, caregivers, and older adults. And all of this work was recently acknowledged by not only not no other by AARP, because we were just notified yesterday that we, Inland Empire, separately and together, well, separately, the Riverside County and San Bernardino County have been designated as age-friendly counties. I'll repeat that one more time. The work that we all collectively have been doing for the past couple of years, we submitted all that documentation. We put in an application. Carmen did this. She put in all of our work, all of our draft documents, and everything we've been doing up until now. They reviewed all of our documentation. They know what we've been doing for a while. And they actually just yesterday sent us an email saying they are admitting us into their age-friendly network. I think this is huge. This really speaks to your work, your commitment, the county's commitment, the Board of Supervisors who gave us letters of support. But as exciting as this is just the beginning. This is just the beginning. Going forward, we're going to be held accountable as being an age-friendly network, part of the age-friendly network. So buckle, put on your seatbelts, and we are just beginning. So congratulations to you, everybody on this call. I see you. Thank you for joining us today. We'll end with that happy note. Carmen, anything else?
No, thank you all for all your work. And we did it together as the Inland Empire and through the Inland Coalition on Aging. So now on the AARP map, once again, the IE is going to be uplifted. The only other community within our area is actually the city of Riverside that has been designated as age-friendly. So the fact that we've been able to now do it county-wide for our both counties is awesome and amazing. And again, just another step to uplift the IE across the state, really across the nation, because there's age-friendly communities all over the country.
We are going to publicize this
Yeah,
widely as soon as we get the official. I don't know if they give us a
certificate.
certificate or
Mhm.
there's a some type of ceremony, but we'll definitely invite everybody and maybe partner with the counties themselves on this exciting news. So thank you everybody again. Thank you for being a part of our work to ensure that everybody, including you and me, can age well in the Inland Empire. Take care, everyone.